Good afternoon, everyone. This is Don Hoppert. I'm the Director of Government Relations here at APHA, and welcome to our webinar. We've heard from a lot of APHA members and partners that there's a lot of confusion about a number of the legislative actions that are happening in Congress concurrently around issues related to the federal budget. Both the reconciliation package that's taking up a lot of airtime these days in the media. Well, at the same time, Congress is also beginning the fiscal year 2026 appropriations process and also dealing with issues related to the fiscal year 2025 continuing resolution. In addition to that, the administration has sent up already at least one proposed rescissions package to claw back previously approved funding by Congress. And so to better explain these different processes that are happening, we've got a great panel joining us today. I'm going to go through and introduce all three of our panelists first, and then we will get started. Our first panelist is Ann Morris-Reed. She's the Policy Director of the Funders Forum on Accountable Health Project and is also a lecturer in Health Policy and Management Department at the Milken Institute School of Public Health at the George Washington University. For over a decade, Reed served in a range of senior level policy and leadership positions in the legislative and executive branches of the federal government, including Deputy Chief of Staff and Counselor to the Secretary at the U.S. Department of Health and Human Services, Chief of Staff in the Senate, and professional staff member on the Energy and Commerce Committee in the House of Representatives, and received her BA from Harvard College and MPH from the University of North Carolina at Chapel Hill. Eric Gashko is Vice President of CRD Associates. He joined CRD in 2024 and also serves as the Executive Director of the Coalition for Health Funding. Eric has a passion for consensus building, coalition management, and health policy. He has extensive experience in a variety of legislative and regulatory policy areas, including public and private health insurance coverage, healthcare access and affordability, drug pricing, and FDA regulatory science. Prior to CRD, Eric spent 15 years with the National Health Council, most recently as Senior Vice President of Policy and Government Affairs. And finally, Rebecca Boulos, MPH, PhD, is Executive Director of the Maine Public Health Association. She received her PhD in food policy and applied nutrition from Tufts University Friedman School of Nutrition Science and Policy, where she earned a USDA doctoral fellowship in obesity. She received her master's of public health degree with a concentration in social and behavioral sciences from the Yale School of Public Health, and her BA in communications from the George Washington University. Becca is also the chair of APHA's Action Board, and in 2023, she was recognized with the APHA Council of Affiliates Outstanding Affiliate Staff of the Year Award. So as you can see, we have a great lineup of panelists today, and we will kick it off by turning it over to Ann Reed to talk to us a bit about the budget reconciliation process that's currently moving in the Senate. Ann, it's all yours.
Thank you so much, Don, for that introduction. It's wonderful to be with everyone this afternoon, and it was great to see many of you at the APHA's Public Action Institute last week. What a great way to follow up, since there were a number of questions, as you said, Don, about all of these things that are pending right now. So we're right in the midst of congressional consideration of a reconciliation bill that contains a number of tax and other programmatic policies. So I'll start by providing just a very brief process primer on what reconciliation is, and then I'll talk a little bit about the substance, recognizing that there's a lot of fluidity with the substance of the bill right now. So from a process perspective, reconciliation is a fast-track tool that's used to advance legislation that affects policy changes in spending, revenue, the debt limit, or some combination of those three things. Eric is going to talk more about the annual federal budget and appropriations process, but let me make a few points to distinguish between these two things. So first, think of reconciliation as more of a sporadic tool. It was first used in 1980, and since then, 23 bills have been signed into law through this process, the most recent of which was the Inflation Reduction Act 3 years ago, back in 2022. Second, think of reconciliation as something that's affecting mandatory or entitlement spending rather than discretionary spending. And when I use the words mandatory or entitlement spending, I'm talking about programs like Medicare, Medicaid, the Supplemental Nutrition and Assistance Program. So typically when we talk about mandatory or entitlement programs, Social Security is frequently a program that comes up, but to just be very clear, the rules for reconciliation preclude making changes to Social Security in the context of that procedure. So continuing on the process points, reconciliation plays out in two ways. So step one, the House and the Senate have to adopt a framework or a budget resolution that provides spending, revenue, and public debt limit targets. And that framework and directions to committees, there's one or more committee that will be implicated in meeting those targets. And then the second step, once that budget resolution is considered and passed by both chambers, then step two comes along, and the named committees have to come up with recommended changes in law to meet the targets that were outlined in the budget resolution. So each committee's work product is typically stitched together, put together into a full bill that then goes before the full chamber of the House and the Senate for a vote. Like with other bills, in order for the legislation to become law, identical versions have to pass both the House and the Senate, and then the bill would move forward to the president for his signature. So right now, where we are in the reconciliation process is the House has acted, and so we have step one is complete. We're midway through step two. So the House completed its work on the budget resolution bill. It's pending in the Senate, and we're anticipating a number of changes to what the House passed for both policy and procedural reasons. So now let me get into the substance of what is happening in the Senate as we speak. So just to step back, why are we doing budget reconciliation right now? So from the vantage point of President Trump and congressional Republican leadership in both the House and the Senate, they're looking at reconciliation as the most expedient way to advance a number of policy priorities, most notably the extension of the 2017 tax breaks. And this costs trillions of dollars, at least $4 trillion, in order to extend these tax breaks. So to help offset the cost of the bill, there are a number of spending changes that are under consideration, including deep cuts to the Medicaid and SNAP programs. So for those of you who may be tracking breaking news alerts, you've probably seen that there's been a lot going on the reconciliation front today. So to ensure that the legislation that's brought to the Senate floor is compliant with reconciliation rules, senators and committee staff typically consult in advance with the Senate parliamentarian. So think about the Senate parliamentarian as the referee on what is and is not in bounds to take advantage of this fast track reconciliation procedure. So to unpack exactly what I mean when I'm saying it's fast tracked, importantly, it allows a majority vote threshold instead of 60 votes that are required to pass legislation in the Senate. And it also limits time on debate. So these are two pretty important things if you do not have a supermajority in the Senate and you're trying to get something done. So there's a particular Senate rule that's crucial in the reconciliation process. This rule, it's called the Senate Byrd Rule, prohibits the inclusion of any extraneous provisions in the reconciliation bill. So just to say this very clearly, there's a lot in flux, and we are far from final legislative text as the senators are working feverishly to address the parliamentarians' rulings, including some pretty notable ones that were announced this morning. So here's what we do know. The bill that passed the House was estimated by the nonpartisan Congressional Budget Office to result in 16 million people losing coverage through a combination of Medicaid cuts, the bill's failure to extend enhanced premium tax credits for the Affordable Care Act marketplace coverage, and other harmful ACA marketplace changes. So the single biggest Medicaid cut that was included in the House bill, carried over to the Senate bill and expanded, is a new work reporting requirement for low-income adults that are enrolled in the Medicaid expansion group. So what these work reporting requirements entail is that you have to submit documentation showing that you're meeting certain work reporting thresholds, or you have to document and show that you qualify for an exemption. It's worth noting from states, the evidence from states that have adopted these sorts of requirements, Arkansas and Georgia in particular, this is not a policy that actually incentivizes employment. Most people are already working or would qualify for an exemption. It's just bureaucratic red tape that results in people losing coverage. So it's important to underscore that the Senate actually expanded these reporting requirements, and instead of exempting all caregivers of dependent children, it would require parents with kids over 14 to meet these requirements. So these requirements so far are still in the bill. And again, it was the single biggest cut that was included on the Medicaid side. So the parliamentarian has ruled that several provisions in the Senate legislation sort of carrying over, expanding what was done in the House bill, as currently drafted, do not meet reconciliation requirements. These include proposals that would limit the ability for states to use provider taxes to finance their Medicaid programs, and proposals that take away Medicaid, Medicare, and ACA coverage from certain lawfully present immigrants, like those who have a demonstrated need for humanitarian assistance. So the Senate Republicans, what they will do in light of the parliamentarians' rulings, they'll work to see if there's some way that they can amend the language in order to make it compliant, and or they would look for other new spending offsets in order to make up the shortfalls if these provisions were to fall out in their entirety. I also want to touch on the SNAP provisions. So the House bill and then the Senate built on this. It would cut the SNAP program by hundreds of billions of dollars over a 10-year period, the largest cut in program history. Like with the health coverage policies, some of these provisions have been subject to procedural challenges in the Senate. And like we've seen, like we anticipate on the health coverage side, the senators are going to work to remedy where there are violations in order to preserve savings in the SNAP program or find new ways to cut the SNAP program. So with all that's in play, you can see it's a very dynamic process. Here's the sentiment that I would leave you with before turning the floor over to Eric. This is a key moment to continue to reinforce how important health coverage and food security are to achieving optimal health outcomes. Sure, all of us that are here appreciate and understand how interconnected health coverage is as a determinant of health. So Congress needs to slow down, right? Lots happening. We don't have final legislative text, like we, the public, don't have it. The senators and the members of Congress don't even know exactly where things stand right now. So it's critically important for members to have an opportunity to see any final legislative language before it's brought up for a vote, and to understand exactly what it means for their constituents and the communities they represent, what that means in terms of potential coverage losses on the health coverage side, what it means in terms of people losing SNAP benefits, and any attempt to plow forward in order to meet a July 4th deadline is really, it's arbitrary, it's self-imposed, and it would be incredibly political at this point in time. So with that, I will stop. I'll look forward to answering any questions that you might have. And Dawn and Eric, look forward to turning the floor back over to you.
You, Ann.
Right. Don, I think you're on mute. Did you want me to go ahead and get started?
Go for it. Yes, it's all yours. Floor is yours.
All right. Thank you so much, Don, for having me here today. And thanks to APHA for hosting this important session. Eric Osho, I'm the Executive Director for the Coalition for Health Funding. We are a coalition comprised of a number of members who are all dedicated to increasing funding for public health programs. We don't specifically focus on any one agency. We really believe that the rising tide lifts all boats model to talking about the importance of public health funding is a crucial role of us and of our members. So with that, I'm going to have you go to the next slide. As both Don and Ann mentioned, I'm here to talk to you about where we are in the FY26 appropriations process for discretionary spending. Want to start with a quick level set on what a quote typical appropriations timeline looks like. I put that in quotes because I've been doing this work for about 20 years, and I don't think I've seen any process work exactly the same as the year before. But just to kind of give you a flavor of sort of what some of those important milestones are along the way. We first see work from the administration to put out a budget. There's a number of steps involved in that, but that is really the administration's expression of their priorities and where they want to see funding levels. But as we'll get into a little bit, it is not a binding document. That's really the role of Congress to then do their work to appropriate funding for the federal government. So once the administration puts theirs out, the appropriations committees really get to work. You see them allocate their funding across the various subcommittees of the Appropriations Committee, who then mark up a spending bill, both in subcommittee and full committee. It goes to the House and Senate floor. They vote on it. It then might be conferenced together, depending on the way they go about it. And then the president must sign it by the end of September, or else we go into shutdown, or what we see quite often these days is something that might be passed for a short-term patch called a continuing resolution or a CR. But September 30th is that date that we all work backwards from. If we go to the next slide, best estimation of where we are, because this process is a little bit different this year, is right about here. Again, the appropriations committees are just starting off in earnest. They've done a number of their spending bills in the House so far, but still waiting for HHS. I'll talk about what that looks like in a second. If you live on the Eastern Seaboard and have been outside today, you will probably know it is not April. It is not uncommon to see the first year of a new administration be on a little bit of a delayed deadline as they work to put out their budget and things of that nature. So there's a little bit of lag that we expect in the first year, but then as we'll talk about, there's a number of other complicating and less usual factors that are influencing the timeline this year as well. If we go to the next slide. So what have we seen so far? The president's budget came out on May 30th. We got a little bit of a sneak peek of that back in April when we saw a memo, an internal memo that was leaked, and we started to see what we would be in store for. The appropriations committees have not allocated their to subcommittees in ways that we normally see. We're starting to see them come out individually for each of the subcommittees before they mark up. So I think we can expect to see the same thing for the Labor, Health and Human Services, and Education spending bill, which the House is planning to take up the week of, I guess, July 21st and July 24th for the subcommittee and full committee. We expect the Senate is probably not too far behind them. We might see those committees act a week after, maybe might slip into the very early part of August before their recess. Likely we'll see September be when a lot of these things come together after their August recess. Would not count against that slipping past September 30th through a short-term CR at some point. So if we go to the next slide, I want to talk a little bit about what we saw in the president's budget. I will again remind folks this is not a binding document. Congress does not have to follow what's in the president's budget. But with that said, if they were to pass spending bills that look anything like what we see in this budget, there would be very significant harms done to our public health agencies and to healthcare in this country. We see quite significant cuts across nearly all of the federal healthcare agencies. We also, I want to talk a little bit about some of the sort of reorganization that we see in that as well. It's important to recognize that it does make comparing some of these numbers, an apples to apples comparison, a little bit more difficult but also just to kind of explain sort of what this would look like if this went through. So one of the things that the budget proposes doing is creating a new agency called the Administration for a Healthy America that would pull in parts of ACL, of HRSA, of SAMHSA, sorry, pull in those entire agencies, and then pull in some functions from CDC into that as well. We also are proposing to put forward an Office of Strategy, which would pull in some of the functions from the Assistant Secretary for Planning and Evaluation, for ARC, for the National Center for Health Statistics, and for the Office of the Assistant Secretary for Health. On the NIH front, there's also significant reorganization that would occur as part of this. It's something that we saw in a House Appropriations bill last year that would propose consolidating the currently existing institutes into what would be 8 institutes, including 5 that would be newly consolidated ones. Would also eliminate a few of the institutes at NIH as well. If we go to the next slide, just to put a kind of finer point and some numbers on what we see in terms of some of the cuts that would be included in the budget. Again, we see significant cuts at CDC. About half of the budget would be cut. Again, some of those functions would move into APHA, but overall, the work that CDC currently does would be greatly reduced, including eliminating a number of programs and offices. Similarly, the NIH proposal would drastically cut funding for NIH across the various institutes. It would be an $18 billion cut, about 40%. So again, very significant cut that would really harm biomedical innovation in this country. And one of the things that we keep talking about as well is just how much that would then really harm the US's leadership in medical innovation. And so it's something that we certainly want to make sure that Congress is hearing about a lot of the concerns that we have with that and a number of the line items and a number of the proposals that are included in this budget. If we go to the next slide. So a couple things that want to make sure we're all on the same page about is there are still a number of headwinds that are going up against congressional appropriators right now. There is limited floor time. There is limited time for debate. There's still a lot of work to be done in terms of negotiation across the parties and across the chambers. Still need to negotiate on what those funding levels will look like, what the programmatic requests are, and all those things that we typically see in any congressional negotiations. As a reminder, an appropriations bill would require 60 votes in the Senate. So there is some requirement for bipartisan negotiation, at least in the Senate. I think it's likely that we will see a bill that it does not look too far out from the president's budget in the House. But in the Senate is really where I think there's a lot of opportunity for us to be advocating for and explaining the importance of public health agencies. There's also the whole notion of the reorganization that's proposed in the budget would have to be debated. We are very firmly in the camp that appropriations committees are not the place to be making such big changes to the agencies. They really need to be done through the authorizing committees. We've had pretty good intel from at least the Senate will not include these types of reorganizations in their bill. The House still to be determined. Again, we did see some attempts at reorganization in the House Appropriations bill last year. It's something that we really want to make sure that while we are not as a coalition opposed to some ways of looking at how we organize the government differently, but it really should be done through a thoughtful approach, through the authorizing committees, through debate, through public input, all of those things. Also, we'll have to kind of figure out what some of the potential other policy inclusions might be. One very notable one was that the budget does include what the administration put forward earlier this year to limit indirect costs for NIH funding. That'll be something that we might see in at least one of the appropriations bills, and really making sure that that something like this is not included. There's also the whole nature of all the things that we've seen over the course of this year, from grant cancellations, from reductions in force, all of the withholding of federal funding. That is going to A, make the budget math a little bit harder, B, has really disengendered a lot of the bipartisan goodwill in terms of some of the negotiation that has to happen. So I think that's certainly going to be something that's going to play out here as well. And then last but not least, I'll mention, Don mentioned earlier that we've seen one rescissions package go forward. The House passed it a few weeks ago. It is currently in front of the Senate right now. Just as a quick reminder, this is a rescissions package that would rescind significant funding for foreign aid, for NPR, and for excuse me, for NPR and for public broadcasting. I will note that it was not unintentional to choose these ones to go in the first package. They are probably a little politically easier to cut funding there than things like NIH funding, but it's very clear that this is being sent up as a trial balloon to see if they can get this funding rescinded. We will likely see it in other areas as well, potentially including a lot of the programs that we focus on. Notably, it takes 50 votes in the Senate to rescind funding, while it takes 60 votes to pass it. So that also is going to, and we heard this a lot yesterday in an Appropriations Committee hearing, it's going to really make negotiations a lot more difficult for senators to appropriate funding, have a 60-vote agreement on it, and then the administration come back, ask for a rescission. It only takes 50 votes to do it. So it'll be really interesting to see not only what happens to the funds that are included in this rescission package, but what this process may hold in terms of bipartisan goodwill and working together moving forward. So that's something that we're keeping a close eye on as well. And then lastly, I'll just mention reconciliation that you just heard about is taking up a lot of the time and effort, also has the opportunity to kind of really frustrate some folks and potentially could have an impact on some of the negotiation here as well. So more to come. The next month is going to be really telling in terms of where we end up, but that's where we are as of today, and look forward to taking questions after the next presentation.
Thank you so much, Eric. And without further ado, we'll turn it over to Becca. She's going to talk a little bit about APHA's affiliates and how they are engaging, as well as how APHA members can engage in these efforts to support public health funding and fight against the various efforts to cut and claw back existing funding. Becca, it's all yours.
Thank you so much, Don. And I really want to thank everyone who's on the webinar with us today. It's great to see so much interest in this topic. And I know there's a lot going on. So an extra thanks to Anne and to Eric for giving us that overview. Like Don said, I'm going to talk a little bit about the APHA Action Board, and then I'll also talk a little bit about the state affiliates. So the APHA Action Board is a group of 14 of us, and our job as volunteers is to help coordinate the association's grassroots and grass tops advocacy activities and encourage people to participate in action alerts and speak for health and meeting with their members of Congress, meeting with others in their state around advocacy issues. And so to do that, we connect with all the different sections across the association. We connect with the regional and state of affiliates. We connect with the caucuses. So each of us is assigned as a liaison to those different groups, and we'll reach out and just, flag if there's an action alert or some type of action that we're hoping that people will take. So what I would say is that if you are a member of APHA and you haven't heard or you don't know who your liaison is, to reach out either to me as chair or to Jordan Wolf, and we're happy to help facilitate that connection. But really, that's our work. That's what we do as volunteers, is we help encourage people to engage in that grassroots, grass tops advocacy. So if you've not been on the APHA website recently, I encourage you to go to this page that I'm going to put in the chat now, and actually ask Dawn to share that with you all. But on the website, under the advocacy page, what you'll see is an overview of all the different actions that APHA is involved in when it comes to advocacy. They have a lot of different resources on there around Speak for Health, about finding out who your members of Congress are. You can see what their latest action alerts are, and I'll also put those in the chat in case you've not added your name to those recently. You can also sign up to get their action alerts if you're not already receiving those, and that's under the Stay Informed section on the website. So there's a lot of helpful information on here. The other information that's on here are the APHA policy briefs, and these are evidence-based evidence-based information about different policies. And we use them at the state level, for example, when advocating for different state public health policies. And so there's a whole library of those briefs and what used to be called statements. And so I just want to make sure to uplift this resource, this really helpful webpage, in case folks have not checked that out before. So I'm going to pivot now a little bit and talk about the state public health associations, because I know we have some folks on here from those associations. And if you're not already connected with your state affiliate, I want to make sure that you do that. So every state and some regions have a public health association, and primarily we tend to focus on state public health policies, but certainly we do some federal advocacy and have been doing, I would say, a lot more right now, especially when it comes to public health funding. And if you have not already connected with your state public health association, I encourage you to do that. It provides an avenue for you to engage in advocacy and public health programming at the state level and also at the federal level. We're always looking for help from our membership and from others in our state that work in public health on our advocacy and our programming. I will share that right now we're actually working on a letter. It's directed to Maine Senator Susan Collins, who serves as chair of the Appropriations Committee. But we have people who have signed it, organizations who have signed it from all across the country. It's primarily focused on fiscal year 25 and making sure that allocated funds from Congress are spent as they were intended, and uplifting some of the cuts that Eric covered in fiscal year 26. It definitely does not cover everything. There's a lot, but we have uplifted some of the cuts that we're concerned about. I'm going to put that link in the chat in case your organization would be interested in signing on. We are still collecting signatures. And I think that is really all that I wanted to share. I just wanted APHA members in particular to know what the action board is, what our role is, and that we are a resource for you. And then for everybody on here, even if you're not an APHA member, to know that there are state public health associations that are very eager to bring you into our fold if you're not already, and get some assistance, like I said, engagement on our programming and on our advocacy. And with that, Dawn, I will turn it back over to you.
Thank you so much, Becca. And if you have a question, please enter it into the Q&A. I know I said chat. Honestly, you can do it either way, although I think the chat might be disabled. So you can certainly enter any questions you have into the Q&A section, and I will ask them of the appropriate person. But why don't I start with a question? I have a question for Anne. And can you may have said this, but can you kind of explain a little bit more about what type of funding is eligible for being increased or decreased within reconciliation versus the appropriations process?
Sure, Don. So typically we're looking at mandatory or entitlement spending in the context of reconciliation. So and that distinct from what Eric was talking about, the funding, the discretionary funding that would support a range of CDC programs and activities. Likewise for SAMHSA, HRSA, he talked about a number of public health service agencies. So the things that are under discussion now are things like Medicare, Medicaid, the Supplemental Nutrition Assistance Program. One thing that when we talk about mandatory entitlement spending in general, usually Social Security is a program that comes to mind. but the reconciliation rules actually preclude making changes to Social Security. So we're really looking at things like Medicare, Medicaid, SNAP. I will just note that in the context of public health and programs and activities that APHA and its advocates track and pay attention to, there is a mandatory source of funding that was first authorized in the Affordable Care Act, the Prevention and Public Health Fund, which was intended to essentially expand the reach of a range of CDC and other public health activities and programs. So that is it is a mandatory pot of money. There were previous concerns that there might be attempts to claw back or rescind that funding stream, but so far that has not been on the table. So that would be an example, unlike Medicare, Medicaid, where you have eligibility criteria, you meet them, and then you have access to certain services. This is sort of a dedicated mandatory pot of money that's sitting out there for public health. But like I said, right now, it's not on the table for discussion.
Thank goodness, because it was one of our big worries, because it has, as Anne knows well, it's been used as an offset in so many previous, or used and or attempted, including by Democrats. So it's one of those things that we are constantly fighting for. And I know affiliates like Becca's, the Maine Public Health Association, and the other APHA affiliates have advocated strongly to support the prevention fund and oppose efforts to use it for its unintended purposes. Eric, I know in Washington, we always kind of joke that the president's budget is a suggestion, and that Congress receives the proposal and then they kind of like push it to the side and do their work. What makes this year different?
I think it's a lot of what we've seen in terms of how, particularly in the House, a lot of the House Republicans are following the leader of the Republican Party, the president, very closely in ways that I think we haven't seen before. It has a very united caucus around him in ways that we often don't see from either party. So I think that there's certainly that concern. And again, I would probably put that concern more heavily in the House, where they only need 50 votes to pass an appropriations bill. Their margins have gotten a little bit bigger as the year have gone on, so they are able to lose a few votes. But I do think that when you see a lot of the significant cuts, not just at HHS, across the federal government, there are a lot of folks that are in the House that are very supportive of that. Many might want to see it go further, as we've seen with some of the previous bills, including the reconciliation bill. A lot of what they've had to do was kind of move a little bit further to the right to get folks on, as opposed to moving towards the middle. So I think it's likely that we might see something somewhat similar to the budget in the House, but the Senate, again, is a whole other ballgame because of that 60 vote threshold. And even then, you still have, you look at Susan Collins being the chair of the Appropriations Committee. She has a lot of influence over that process. She's been very supportive of many of the programs that we care about. So I do think that there's an opportunity there, but that's not to say that some of the public health agencies are the most popular with broad swaths of the Republican Party at this point. And so I think that we're kind of getting hit from both sides, where you have just this general desire to lower costs, or lower spending as it relates to all the work that we saw from DOGE and others. But then public health has, I think, its own unique circumstances that we're going up against coming out of COVID and things like that. So I think I don't want to have people assuming that, things are going to go as well as they have in the past. We've often seen attempts to, zero out ARC, for example, and it's always survived. NIH has always seen at least level funding, often sees increases. But even that agency is facing some headwinds right now. So I think it's really beholden on this community to really talk about the importance of the work that all these agencies do and how important it is that they are fully funded, fully staffed, and really operating at the highest level possible to improve the health of all Americans.
Yeah, that's actually perfect. Oh, go ahead, Anne.
Yeah, sorry, Don. And if I might just piggyback off of a point that Eric was mentioning, I think another thing too, to just connect this back to the reconciliation discussion is, as I said, things are, very live as senators are working to try to ensure that their language is drafted complies with the reconciliation rules based on the guidance they're getting from the parliamentarians. But a point that I would make is if we're in any situation where there is cost shifting to states, in the Medicaid program, in the SNAP program, or there's a new requirements such as the work reporting requirements, they're going to add administrative burden and likely put further strain on state budgets. So you're constraining state budgets. States have to balance their budgets. If we're doing that with programs like Medicaid and SNAP and putting those budgetary pressures there, and then you're backing out federal funding for public health activities, recognizing that the vast majority of CDC funding is actually going directly out to jurisdictions. That is putting a tremendous amount of stress and strain on budgets at the state level. So I just wanted to underscore that point.
Yeah, many states even
and to make it even worse, you're taking away health coverage from people at the same time. And so it's like this, self-fulfilling prophecy from hell when it comes to the healthcare and public health system, all kind of happening at once from various angles. So we haven't even talked about lawsuits and all that kind of stuff yet, but maybe we'll save that to the very end. Eric kind of set up a good point about how it's really important for members of Congress to really hear from their constituents about why this money is important, even from even senators that might generally be supportive of this, because there are so many other things going on now. It's more crucial than ever. Can you talk a little bit more about what Maine has been doing with Senator Collins and others to kind of keep this on her radar and on her priority list?
Yeah, thank you, Don, for the question. Before I answer it, Eric, did you want to add something else to what Ann was saying?
Yeah, so just one quick thing. Ed makes a really good point about the pressure this will put on states, and do want to note that a number of the expansion states have trigger laws on the books that if any of their funding is cut, they will undo expansion as well. So there are decisions that they'll have to make, and there are some that will be made for them if these provisions go through. So yeah, the impact on states is going to be massive.
Yeah, I think that one thing that we're doing in Maine, and I know other states are doing as well, is meeting with our members of Congress. We're meeting with their staff and sharing examples of what this funding, these proposed cuts look like in our states. And so it's really easy when you have all these programs, all this funding, to not fully understand how that translates in your state and in your district. And it's programming, but it's also workforce. It's, access to healthcare, like you were just talking about, Don. I mean, there's multiple dimensions that are impacted. And so one of the things that we've been doing is looking at what are these programs in Maine, who's working in them, what's it look like on the ground, and we're sharing those stories. We've been collecting constituent stories. We have a podcast at Maine Public Health Association. It's called Healthy Maine Talks. If you haven't checked it out, you should. We're one of the top podcasts in the state. I don't know how much competition we have, but we're doing great. But I would say two of our special episodes on federal impacts are one's on SNAP and SNAP Ed, and the other one's on AHEC, the Area Health Education Centers. And in the podcast, our associate director is interviewing people who work in these programs, and they're talking about the important work that they're doing. And so we're using our medium in that way to share these stories from people in Maine that are impacted by these proposed cuts. And I think that, for other states and for other organizations that are listening to this, thinking about creative ways that you can relay those constituent stories, whether it's good or bad. I think sometimes when we think about these cuts, we're really focused on the negative impacts, but I also think hearing from people about the positive impact that this funding has had on them and on their communities is also really important to share. And so as much as you can do that, as much as you can uplift those stories and those impacts and really translating what this funding looks like, it's really easy to not fund programs that you don't understand. And so hearing from people about what the programs are, I think it's really important. And it's what we're trying to do here. And I know what other states are trying to do as well.
And I know CDC has this and HRSA has this on their websites. You can go and actually pull down a fact sheet for your state that tells you exactly how much money and from what category and goes to your state. And the CDC one, I think, even lists like every single grant recipient. And so it's a good way to show, as Ann said, the vast majority, it's about almost 80% of CDC money goes out the door. Obviously, it's important to have a strong, staff at the agency on top of the grants that they send out. State and local health departments heavily rely on CDC for technical expertise and data and other resources. So, and you all, as folks who work in the communities that receive this funding, are the ones who can make the best case. I do this, Eric does this, Ann has done it. We go and we talk to legislators and they appreciate and they trust us, but when they hear from folks back in their states saying the same things, that's when they're really gonna pay close attention to the impacts that it's going to have. And we've had members who have invited members of Congress or their staff to a program that's funded by CDC, HRSA, or a research, center that's funded by NIH, so showing them firsthand what those federal dollars are doing and what will go with what the community will go without if the money were to go away. So there's a lot of ways that you can advocate. You don't have to just come to Washington. You can do this advocacy back in your state as well. All members of Congress have district offices. Senators generally have several throughout the state. Even House members generally have more than one throughout their congressional district. So it is an opportunity for you to go in and talk to staff there, but also when Congress is on recess, members of Congress use those district offices as kind of their home base, and they will often have open hours or town halls or other events where you can go and talk to them about the importance of public health. And one more question for you about reconciliation, since that's the thing that's like really moving right now. What do you think? I mean, I know it almost seems like once you make an adjustment to get this group on board, it may shift something on the other side. So what do you think are kind of like the biggest outlying issues right now that Republicans are gonna, I say Republicans because clearly at this point, no Democrats are gonna vote for this. So what do you think their biggest hurdles are?
Well, it's wild. So in the and this is not, I think this is not unlike what we'll probably see in the context of the appropriations process in terms of just different parts of the Republican conference and just some of those tension points. So just to say that. So in both the House and the Senate, you have the fiscal hawk sort of faction of the Republican conference that really is not even satisfied with the level of debt reduction that is currently in the House bill and the updated Senate bill. Like they want deeper cuts. So you have in the Senate, just to call out, it's folks like Rand Paul, Ron Johnson, just as examples. So we're not to the point where they're even satisfied, right? And again, you have a similar sort of faction in the House. And then you have folks that are more moderate and are concerned about a few things. So in the Senate, we have some senators, including Senator Collins, who are very concerned about a particular set of Medicaid provisions that would limit the ability for states to tax providers, which is a key way that you help fund Medicaid programs. So they're concerned about what that would do, particularly to rural hospitals. So that is a pain point for them. In the House, a pain point is the extent to which folks that are living in higher cost jurisdictions like New Jersey, New York, California can take deductions for state and local taxes, the so-called SALT provisions. To be clear, the Senate is less concerned about that, which makes sense because when you think about the representation in the Senate, you don't have Republican senators from those states I just mentioned, so it's less of an issue for them. So this, what the Medicaid changes would do to rural America, the SALT and how that's dispensed, have we gone deep enough in the spending cuts? Like, these are some of the tension points. Also, I should add, some senators and House members don't want to raise the debt limit in the context of reconciliation, which is currently part of the package. So these are some of the pain points. The Senate parliamentarians' rulings this morning really sort of threw a wrench into all of this, because one of the key things that she said doesn't meet the reconciliation requirements is this provision that would limit the ability for states to use those provider taxes to help fund their Medicaid programs. And that provision was estimated to save hundreds of billions of dollars. So that's a big hole in terms of how you offset the cost of the tax provisions I was talking about and other things. So I think this is going to be very live to see whether the answer here is that the Republicans like redraft the provision in a way that would pass muster and they're still able to preserve some of those savings and do it in a way that makes moderates like Senator Collins comfortable. Senator Tillis is another example. Both of these senators are in cycle in competitive races in 2026. So you have that added dimension. So I think that is going to be kind of a key issue that we'll see play out in the Senate over the next, sets of hours, days, and finding some balance between the senators who would prefer to do little to nothing on SALT and the moderates in the House is going to be, I think, another big outstanding issue and a needle that has to be thread.
Sounds like they have their work cut out for them. Eric, anything you would add on the appropriations process in terms of, I know you talked a bit about the House versus the Senate. I know the last couple cycles, the Senate Appropriations Committee passed almost all, I think almost all, maybe one they didn't, at least through committee in most of them on very strong bipartisan votes. What do you think about this year? Is that still a possibility?
I don't know. Yeah, I mean, there's still a lot to be determined. That's, hopeful that'll be the case. Obviously, the Senate looks different than it did last Congress as well, with the change in majority and probably bigger margins. I think we would have expected bigger margins that we saw there. So I'm hopeful that we'll still see some real bipartisan negotiation, some honest brokering to get to a level that'll be satisfactory to pass the Senate. It's possible. I think I also wouldn't say that all appropriations bills are built equally. Some are more challenging than others. Labor H is often one of the more challenging ones. So it could be that we see a number of bills make it through a committee, others are attached to some sort of CR or omnibus, sort of like a bigger spending package or a mini bus. So I think it's still to be determined. We've had really good conversations with folks in the Senate. They are very much in the throes of that negotiation with committee staff at this point. And they are working to get to a point that they can all be happy with where they are. So as of now, that's where they are. Those things can change. Again, all of the other bills moving forward and things can often throw a wrench into that. But, I think as of right now, I think they're kind of in a good place for where they could be. But we'll see.
Yeah, I was pleasantly surprised when I was watching the hearing yesterday on the rescissions package and Senator Collins and Senator Murkowski and I think even Senator McConnell are raising concerns about some of this stuff. So it seemed pretty clear that several of them were not comfortable with that. So it gave me some hope that, there is still some bipartisanship left when they see bad decisions being made. And hopefully, in an effort to make good decisions, they'll have a bipartisan way forward. I guess it's all going to come down to show me the money. Like, how much money are you going to give me for this labor HHS bill to determine whether or not it can really be a true bipartisan process.
And I do think that I was also pleasantly surprised to see not just what they were saying, but kind of how they were saying it. I think it was notable to see some of the kind of more longer standing senators really talk about the importance of Congress's role in appropriating funding. That's something that we've had some concern about over the course of this year as we saw a lot of the administrative actions and Congress not being as willing to sort of step up and speak out against some of those things and really protecting that power of the purse. Because that is going to be a huge issue moving forward. And I think for many of us who care deeply about these processes, want to make sure that that stays in Congress's hand. And so I think it's good to see folks like Susan Collins, who I know really cares about ensuring that Congress keeps the power of the purse. It's going to be really important that they continue to kind of keep their foot on the gas and keep the feet to the fire. And a lot of that's going to require us reminding them how important that is as well.
Any last words of wisdom from any of our panelists that you want to share before we wrap up? I guess I would say, like, don't ever give up. Like, you never know. It's never over until it's over. We did share the link to APHA's Action Alert site. We do have action alerts up there for both the FY 2026 process, urging Congress to prioritize public health and to oppose a lot of the reorganization attempts and massive reductions in funding at many HHS agencies. And there's also an alert up there on the reconciliation process, urging both, and you can contact the House or the Senate, urging them both. Now, even though the House has passed a bill, they still are going to have to vote on another one before this is all over. So it's not too late to contact them, as well as your senators, as they work perhaps over this weekend to try to get the bill done. It's unclear, as Anne mentioned, that a whole bunch of new hurdles are popping up every day. So the timeline on that is kind of up in the air. A lot of pressure from the White House on Congress to do it by a certain date, but who knows? We'll see. So I just want to thank all of our panelists today, all folks that I've known for quite a while, work with them all the time. So really appreciate hearing their takes on these complicated issues. Hopefully this webinar made these various processes a little easier for you to understand. We'll continue to cover these things in APHA's legislative update, and I will get this webinar posted on our website and share the recording with those who attended and as well as those who weren't able to make it. So again, thank you all, and have a great weekend. Talk to you
Thanks,
soon.
Don.
All right,
Thank you.
Thanks, Don. Thanks, Becca. Thanks, Eric. Bye-bye.
Thank you.
bye.